Diabetes mellitus, or type 2 diabetes, remains to be among the top killer diseases in the Philippines. Let's learn more about this disease and how to prevent and properly manage it. We are joined by Dr. Aurora Macabalog of the Philippine College of Endocrinology, Diabetes and Metabolism. Doc, thank you so much for joining us.
Good evening po. Thank you for having me, ma'am.
Now, let's start. How did the Philippines find themselves that type 2 diabetes is the fourth leading cause of death? Is it because we're not diagnosing it enough, not enough treatment? How did this happen?
There is no clear data regarding that. What really, would be the factor really that we can put our fingers on? But there are a lot. Well, in the past, as we remember, we are an agricultural land, and in the recent years, our lifestyle has become more modernized, especially the diet. And as far as the lifestyle is concerned, it has become lax as well. So those can be a factor also in the increase in prevalence of diabetes. Now, regarding the poor pickup or diagnosis, maybe so, and that may be something that our health department can focus on, but definitely there has been improvement already as far as the diagnostics are concerned, and the government has been really providing tests for Filipinos, and these are open with the PhilHealth. We have the PhilHealth free laboratories. They will have to register, and that's another program of the PhilHealth. So as far as diagnosis is concerned, I don't think we are really that far behind. It's just that maybe it's in our culture, yung medyo we are not really, a lot of people are really playing it down when they feel something and they don't go to the doctor immediately, so that could be a factor as well.
Could you tell us what are some of the symptoms that you have type 2? I mean, if they're not going to the doctor, it must be something that they can manage or something that they usually overlook.
Okay, well, this could be a surprise to a lot of people because we have in mind that when a person is diabetic, a wound will not heal or they will feel something. But most of the time, they will not feel anything. So patients may present asymptomatically, and most of the time, we are able to pick up a patient because of something else, like a laboratory, for example, or a routine lab wherein we see a high blood glucose. If and when a patient feels something that is related to diabetes, it could be weight loss. That's unintentional weight loss, meaning they did not intend, okay, well, no dieting, no rigid exercise, but they keep on losing weight. And then the increase in urination, or what we call polyuria, and then increase in thirst. Some would also complain of weakness. Okay, those may be the symptoms. But again, when they feel the symptoms such as those, then the blood sugar may already be really high.
So how?
So
how does it lead to that?
With the diabetes, these people will not have an efficient metabolism of their blood sugar, so they will pee it out. There will be an increase in the urination. So because we pee out the water, the glucose will pull out the water, pee some more, and then the patient will generally feel dehydrated, more thirsty. And because there is no efficient caloric metabolism, and then there can be weight loss. Now, there are some risk factors that we have to look into, that if we have a first-degree relative, immediate family, if we have a strong family history of diabetes, then we have to be tested at the age of 40. We have to be screened, even when we're not feeling anything, merely because we are at risk for diabetes. For those women who had a history of gestational diabetes, that's a diabetes during pregnancy, they're also at risk, so they may have to be screened after pregnancy. And of course, those who are overweight and has obesity, those are risk factors as well. So if a person has those, then it would be prudent to have him or herself tested or screened.
How does this disease develop? Are there early symptoms that we can detect so that, it won't worsen?
Yes. So as I said, if there'd be any symptoms, it could be weight loss, could be increased in urination, increased thirst, okay, or some would present with weakness, lassitude. Okay, so if you have those things, then you may have to go to a doctor to have yourself checked and probably rule out diabetes.
Now, what can be done to, of course, first avoid getting diabetes, and for those who already currently have it, what can be done to prevent it from getting worse?
Okay, we always know that prevention is better than cure.
Yes.
And it's good that the question is geared towards prevention because in the Philippines, the prevalence of diabetes has been increasing over the years. Pre-pandemic, the last data that we have from the expanded National Nutrition Survey showed that the prevalence was around 8.2. From 10 years ago, it was about 4. Okay? So really, it has been increasing. Even the impaired fasting glucose. When we say impaired, it's just high, abnormally high blood sugar and not yet reaching the diabetes yet, but they're already pre-diabetic. So over the years, it has increased. And you can imagine when we had the pandemic, when nobody was able to go out, exercise, and there was a lot more access to the food in the refrigerator in the kitchen.
Exactly.
So you can imagine how that affected the glycemic status or the blood glucose status of a lot of the Filipinos. So for that, we need really to have a healthy lifestyle. It's paramount in these chronic diseases that one should be very mindful of the things that you eat and the lifestyle as well. We always have recommended a healthy lifestyle that is exercise that would be amounting to about 150 minutes per week. You can divide it as long as it's around 150. That's for healthy, standard healthy exercise. And should be no 2 days that will be without exercise so that you can optimize the effect or the benefit from the exercise. Now, with dieting, we cannot just exercise and don't go on proper diet. When we say diet, there's a misconception that when we say diet, they don't eat. Okay? They try to eat very, very little.
Yeah.
So that is not right as well. When we talk about diet, we talk about balanced diet. We have the Pinggang Pinoy, and we are reminding the Filipinos about the Pinggang Pinoy because it's a very simple idea. It's about if you're going to look at a plate and you divide it into 4, so half should be vegetables, 1/4 should be carbohydrate source. That would be your rice, that would be your bread, okay? And then the other 1/4 will be protein. That would be your fish, your meat. Okay? So those are the things that have to be seen in your plate. But nowadays, when you see your plate and you see plenty of rice, then there's something wrong with the allocation of the food that you're going to take. So being mindful of these things will help one to avoid or prevent having diabetes later on. Okay, so keep a healthy lifestyle.
Dr. Aurora Macabalog of the Philippine College of Endocrinology, Diabetes and Metabolism. Doc, thank you so much for joining us.
Thank you, Paul.